This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. I'm Dave Wilson. Got a couple of guests joining us on today's show. Please welcome Tricia Julian, Oncology Nurse Navigator, to the program. Tricia, good morning.
Good morning, Dave. Thank you for having us.
Absolutely. And Kathy Kerzak, Coordinator with Pastoral Care at Mon Health. Kathy, good morning. Thanks for joining us.
Oh, thanks, Dave. Glad to be here.
We're going to be talking about Preserving Brave and Joyful series, the PB&J Cancer Support Group. We're going to get into that topic in just a moment, but as I'm sure both of you already know, I say this every week, we have to get the guests to talk about themselves at least for a minute or two. So, Tricia, we'll start with you. Tell us about your background, where you come from, where'd you go to school, and how you ended up working with Mon Health.
Okay. Well, both of my nursing degrees are from Vermont State, and I originally worked at Mon from the mid-'80s up to the year 2000, and then I wanted to be able to have holidays and weekends off with my kids, so I took a job in Fairmont, where I live, for 18 years, essentially over the cancer program there at Fairmont. And then I got an opportunity to come back here about 5.5 years ago, and I jumped at the chance to come back to this hospital because it's home for me. I really love this hospital. I love the people I work with, and very, very happy here. So that's what led me back here.
Tricia, what is the role of an oncology nurse navigator?
So a nurse navigator gets in contact with patients when they're first diagnosed with cancer, and then essentially walks them through the trajectory of their disease process. I do education with patients who are newly diagnosed, which is really my favorite part of my job. You can take a patient who is really terrified and arm them with education, and they can go forward with the treatment and with the rest of the disease process. I also can be involved with the survivorship piece of their cancer journey, where I do education with them about what goes after the treatment. What do they do after that is all over? And it's becoming more and more important with more and more of our patients having cures and doing really well, living with cancer as a chronic disease.
All right, Kathy, tell us about yourself. Where are you from, and how did you end up with Mon Health?
So I'm originally from Mississippi, but I've lived in Morgantown for about 34 years, so I think it makes me official as a West Virginian at this point. And I have worked at WVU. I worked in parish ministry, and following a couple of cancer experiences of my own, I started moving towards this current role that I have as a chaplain. And I found my way to Mon Health because it was a wonderful place, a wonderful opportunity, and it couldn't be any better of a fit for me.
I don't know, Kathy. It's only been 34 years. I'm not sure. Well, guys, thanks for joining us. And like I said, we're going to be talking about the Preserving Brave and Joyful series, the PB&J Cancer Support Group. Tricia, what is the PB&J Cancer Support Group? What is that?
This is a pilot project, and it actually was the brainchild of Kathy. Kathy came to me and said, I really have this idea and would like to see it come to fruition. And so it is a series of 4 meetings that we will have with patients, 4 sessions, and they deal with various topics that cancer patients deal with. And we'll go into that in greater detail in a little bit, but we really wanted to offer these to cancer patients so they would have an access to increased knowledge in a lot of these areas, but also to have camaraderie with other cancer patients. And having Kathy be a cancer survivor herself, it was a tremendous help to have her input and to design this with her.
So, Kathy, Tricia said it was your brainchild. How did you come up with this idea, and why did you come up with this idea?
Well, actually, I was doing some research around emotional intelligence and was learning all this great information about how we can help ourselves when we're experiencing things like cancer. And research shows how much optimism and hope help people to do better when they're in the midst of those kind of battles. And so also, an effective thing is a support group. And we thought we can do better than that. We can really make something that has a support group embedded in it, and it can be something that can be wonderfully supportive to people.
So how did you come up with the name, and what does that name mean, Preserving Brave and Joyful Series?
So it's actually persevering, brave, and joyful. I was just playing around some words that had positivity and came across the combination that made PB&Js, which we liked because our motto is we stick together. So it's a little corny and it's a lot of fun, and they're going to actually have a T-shirt that will be given to them that has a PB&J on it and the Persevering, Brave, and Joyful theme.
I thank you for very kindly fixing my mistake there, Kathy. You'd think being in this business long enough, I would be able to read the notes in front of me.
Easily made, Dave.
Persevering, Brave, and Joyful Series, the PB&J Support Group. Before we take the break, Kathy, I'll kick this question to you. Who can be part of this group? Who should seek this out?
Anyone who is in the midst of cancer treatments, wherever they are in that experience, anyone in this community, in this area who is having that experience, would love to have them come and be part of this. And, we want to make sure that people know this is something that's for everyone. All you introverts out there, we're going to actually make this big experience a little smaller by placing you at tables with a Mon Health host who will kind of, make this experience small in a small group, and where you can really get to know people. And I think that's going to be, we're going to meet you from the time you hit the door. We're going to be there and guiding you. So no one's going to be left to feel off-put by this experience. You'll be welcomed.
One more quick question before we take the break, and I'll pose this to you, Tricia, as the nurse navigator. When someone receives the cancer diagnosis, I cannot imagine it. It has to be devastating, but I would guess is there a feeling of loneliness that goes with that? Even if you have family and friends around you saying they'll be there for you, is there still that feeling of maybe, is it an isolation? Is that a fair statement?
Absolutely, Dave. It is. Family can gather around them. They can support them. But in most cases, they don't truly know what the person is going through. Another patient with the cancer diagnosis knows exactly what that person felt like when they got their cancer diagnosis, all the trials and tribulations that they've experienced going through it. And so that was one of our biggest wishes, was to get people together to be able to support each other and learn from each other.
Our guests this morning on Mon Health Talk, Tricia Julian, Oncology Nurse Navigator, and Kathy Kerzak, Coordinator, Pastoral Care with Mon Health. We will continue our conversation on the other side of this break. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning on the show, Tricia Julian, Oncology Nurse Navigator, and Kathy Kerzak, Coordinator, Pastoral Care. We're talking about the PB&J Cancer Support Group, Persevering, Brave, and Joyful Series. So, Kathy, can anyone participate in this group? Does it have to be a patient with a diagnosis? Can family, friends, other supporters be part of this?
I think if it would make people be more comfortable to participate, we'd love to have a +1 to accompany them, and maybe that helps them get through the door.
Tricia, why is this type of group or just support in general, when you're talking about a cancer diagnosis and treatment plan, why is that support so important to the patient?
Well, collaborating with other patients can help the person know that they're not in the fight alone. It can feel, as you alluded to earlier, Dave, very isolating whenever you have a cancer diagnosis, and that feeling of just feeling like no one really knows what you're going through. And we are going to get people together. We're going to get them talking about their diagnosis and other things, and how to shore themselves up and support themselves emotionally, teach them how their family and friends can support them, and give them the tools that they need to do this journey.
Kathy, what are some things guests can look forward to when they join this group and become part of it?
So I guess some of the things that we hope that they'll experience emotionally are feeling that they're being accompanied, to share their experiences with others. And, we really hope it's going to be uplifting. But some of the things as far as the shape of it, there's going to be icebreakers. There's going to be a speaker each week, and it's only a portion of the time. We want a lot of the time to be spent at the tables with them interacting with each other. And then there's the tools that we're going to be offering as a theme each of these gatherings, so that people can help navigate their cancer battle.
How often will you meet? It sounds like once a week. For how long, or a couple times a week? How often will you be getting together?
We're going to be meeting once a month.
Okay.
We felt like that would give people time to attend and then plan for the next one. And we really do hope that people will attend all 4 sessions, although they could attend just one if they desire. But we really are hoping that people will. And our thought is that if they attend one, they're going to be really, really enthusiastic about it and really want to attend the final 3 sessions.
Kathy, what would you say to someone listening out there this morning and they're thinking, this sounds interesting, but man, I don't know. I don't like necessarily getting in the group setting. I don't know if I want to go talk about this. What would you say to that person who's a little bit hesitant?
I'm going to encourage them to come and see. Come stick your toe in the water and meet some friends you didn't know you had, and see if this is something that might just give you the boost that you need.
Kathy, how much did having that type of support, or did you have this type of support when you had to battle cancer yourself?
Well, I did have a support experience, and it didn't leave me feeling uplifted. And that's part of, there are actually 3 of us who are cancer survivors who kind of put this together initially, Tricia being the other one, Luella Gunter as well. And we all just wanted to create something that was going to, what we thought we knew were the needs of many of these people. And so that's where it came from.
Tricia, let me pose kind of the same question to you. What did having a support system mean for you as a cancer survivor now, having that support when you were going through your battle?
Well, I'm not a cancer survivor. I've had skin cancer, but not a true cancer. But I've been involved in oncology for 40 years and have seen the benefit to people receiving this type of support, and it's invaluable. The other thing that I wanted to mention, Dave, is that in addition to the introductions and the icebreakers and things that we're having with each one, there also will be dinner with each one of these meetings. So that we're hoping that will be an attraction to people as well.
Tricia, in this business, that's called burying the lead. Well, we're talking to Tricia Julian, Oncology Nurse Navigator, Kathy Kerzak, Coordinator, Pastoral Care, and we've been discussing the PB&J Cancer Support Group. Kathy, where can folks sign up or get more information about this?
So I just want to also mention that the first one is scheduled for August 20th. It's going to be from 6 to 8 in the evening. As Trish mentioned, there's going to be the first one we could go ahead and reveal the restaurant providing the food is Mama K's, which is a great new Italian restaurant in Star City, and we're really happy to be partnering with them for this. And you can actually email Tricia Julian herself, and actually her email address is patricia.julian@vandayahealth.org.
And they also, Dave, could call my office at 304-285-2622.
Well, Tricia, I was going to ask you the when and where part of that question, but Kathy answered it already for you, so you're off the hook on that one. Guys, we have just about 90 seconds left. So, Tricia, I will ask you this. What's one thing you want listeners to take away from our conversation this morning?
I really want them to know that we've designed these courses or sessions, if you will, to give the most benefit to patients. We talked about things that we thought patients could really, really utilize, both during their cancer journey and following that cancer journey in their survivorship period. And so a lot of work went into designing these and trying to think what is going to be the most beneficial thing to patients. Kathy, I'll let you.
Kathy, you as well. One thing you want listeners to take away from our discussion today?
I want them to really strongly think about coming and seeing about what this is all about. Come meet some people from Mon Health. Come meet other people who are having a similar experience, and hopefully that will ignite some optimism, hope, and joy within you.
All right, Tricia, one more time before we go, the who, what, when, where of the PB&J Support Group.
These sessions are going to be held, the first one, August 20th, second one, September 17th, third one, October 15th, the fourth one, November 19th. They're from 6 to 8 p.m., and they will be in the Mon General Conference Center, and they can call 304-285-2622 to register.
Tricia Julian, Oncology Nurse Navigator, and Kathy Kerzak, Coordinator, Pastoral Care. Guys, thank you so much for taking some time, and best of luck with this program.
Thank you, Dave.
Coming up.
Thanks, Dave.
Coming up, top of the hour right here on WAJR.